An overwhelming majority of Americans remain susceptible to the coronavirus. That message coming from CDC Director Robert Redfield, who testified before the Senate committee today, along with Dr. Anthony Fauci, FDA Director Stephen Hahn, and Admiral Brett Giroir, the Assistant Secretary for Health at the Department of Health and Human Services. Take a listen.
A majority of our nation, more than 90% of the population, remains susceptible. It varies in different geographic parts, from states that have less than 1% with evidence of previous infection to some that have more than 15, 20, and one as high as 24%.
The nation's top medical officials there speaking as the number of new COVID-19 cases begin to rise again. Nearly 40,000 new infections were reported on Tuesday, bringing the total number of cases here in the U.S. to 6.9 million. Let's bring in Dr. Leigh Ann-Webb. She's an assistant professor of emergency medicine at the University of Virginia. Dr. Webb, it's good to talk to you today. I'm just curious to get your takeaway on what we heard from the top medical officials, health officials, talking about where we are right now in the pandemic. It certainly felt like there was a bit of a reality check today from all of the officials after so much talk about whether the science or the politics is now in control of policy.
That's right. Thank you for having me, Akiko. So reality check indeed. I will tell you that I was sitting on my computer and signing patient charts, and I was listening to it the entire 3 hours. I watched, and when he said that, I looked up and I paused. And it's a pretty astonishing number, right? So 90% of people are still vulnerable or susceptible to COVID-19. I'm not surprised as a healthcare provider, but we do hear many people arguing about herd immunity. And we also know how devastating of an effect COVID-19 has had, both on the people who died, but also the so-called long haulers, or the people who got COVID-19 and are still having symptoms related to that. If you extrapolate that to a rough estimate of the American population at 320 million, that still leaves 288 million people who are susceptible to COVID-19. And as a healthcare provider, that is an astonishing number.
How should we be looking at that number? So the average citizen saying, okay, so we've got the specific restrictions in place, we are being told to wear masks, and yet 90% still susceptible. How do we digest that statement?
Well, I think we continue to do the things that we have been doing. So the things that we can control specifically before we, get to sort of better treatment, before we get to the vaccination, we can control what we can do and what we do every day in our lives. And those are sort of these public health measures that we've been talking about for the last few months. The most important of which are wearing a mask. Wear a mask to cover your face and your nose. Practice good hand hygiene. So we're talking about washing our hands or using hand sanitizer, avoiding crowds, and specifically physical distancing as much as we possibly can. We know that many people, in order to keep our economy going, they have to show up at work, right? We've been talking about essential or frontline workers for a really long time. But to the extent that you can control those things, you can help us from a public health standpoint, control the virus.
Let's talk about testing, because we did hear the Assistant Secretary at the Department of Health and Human Services talk about the U.S. being at an inflection point when it comes to testing. He said this month, we're going to have an average 3 million tests per day, nearly half of which will be rapid point of care. Number one, is that enough tests to get a clearer picture on what's actually happening? And how do the rapid tests change the dynamic at a time when we've been talking for months now about the delay in getting the test results?
I think it's a step in the right direction. And so the more tests, the better. You do have two completely different sides of the aisle here. When you talk to some people, they say, you should test everyone who's asymptomatic, everyone needs to be tested. And then you have other people who are pretty much like, we need to look at our resources and test the people who need testing the most. For the last few months, we've been squarely in that box where we are limited in our testing resources. And because of that, we do need to prioritize the people who who get testing. And so it's very, very important. I am very excited to hear that news as well, because on the ground, we do have testing capabilities. But of course, any significant delay in tests, meaning 2 days, 3 days, I'm hearing tales of like 4, 5, 6 days. We're still taking people a long time to get their test results. Any length of time that we can gain there and shorten that window is going to help in terms of public health measures like contact tracing, getting people back to work or not, and having them quarantine at home.
Let's talk about what's happening on the vaccine front. Johnson & Johnson today announcing they are in the final stages of their clinical trials. This one-shot vaccine, we did hear from Paul Stoffels, the Chief Scientific Officer at J&J in the last hour of the ticker. But how significant is this when you think about the type of vaccine they're looking at, that one-shot vaccine, and then the scale of the clinical trials with 60,000 patients ultimately being involved?
Again, it's one of those things where the more patients, the better. When you're looking at the safety and the efficacy of these vaccines, we want a diverse, like a geographically, racial, ethnic, we want a lot of diversity, gender diversity, diversity of comorbid conditions. We want all those things when we're looking at our clinical trials so that we can extrapolate those results and see if they actually help for our patient population, right? It's not helpful for me when I'm looking at adult patients to talk about a trial that limits patient enrollment to children or something else. And so we have to be able to extrapolate those results. I think what's most remarkable about the Johnson & Johnson news today is that the vaccine is one shot compared to 2 shots in some of the other vaccines that are in phase 3. And what that does for me as a healthcare provider is it makes me more comfortable with how patients interact with my healthcare system in terms of advising them for a vaccine. So I'll give you an example. If you have 2 shots, that's fine. If that's what we need to do, that's what we need to do, versus 1 shot. If they are the same, the exact same in terms of safety and in terms of how they work and whether or not they work, I am going to pick the one that is 1 shot, because we know that patients love one and done. Providers love one and done as well. And so we see, we have this idea of a prime shot and a booster shot. And we see that in like the MMR vaccines that we get as kids, right? Measles, mumps, rubella. We see it with HPV as well. But what we also see is with HPV is that as the number of shots goes up, either 2 or 3 based on your age, compliance goes down. So will patients come back for that second shot is really the question from a clinical standpoint. And I do think there are some measures that we can do, public health measures, and implementing systems in place so that we can help every patient who wants to get that first vaccine also come back for the second vaccine. So there are a couple of things that we can do there. The other thing is that it is refrigerated as opposed to frozen. And so a frozen vaccine certainly can place some barriers in sort of the storage and the transportation of these vaccines. And so we know that it's important whether or not vaccines are refrigerated or stored to have a very close knit quality control as you go along from the manufacturer, from the time it leaves the manufacturer rather, until the time it actually reaches the patient. And that's true whether it's refrigerated or frozen. I don't see that as a major barrier, given the fact that I hope we're over the hump in actually getting a vaccine. I think we can get some freezers out to the places who need them the most. But more than anything, we all need to work together, and we really need multiple vaccine manufacturers sending these vaccines in order to reach the number of people that are going to be required for this to be successful.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.